So how is drug use a public health issue?
So, I mean, there's the most basic sort of, public health concerns around um, uh, safe, so like safe use or safe substance use. So, um, you know, things like some of the early harm reduction programs around needle exchanges and making sure that we could reduce the spread of infectious disease that can happen if people aren't using drugs in a safe way, if they're reusing needles and then transmitting diseases and um, but then also public health. Um, yeah, yeah. The way the question is, so it's about drug use being a public health issue. So is drug use the problem, or is it the way that people who are using drugs, um, how, where, when they use drugs, and how they are treated more broadly by society? Sorry, I'm trying to work through it. Do you know what I mean? Like there's this difference between saying like it's the drug use. Is it the drug use that's the issue, or is it the like when, where, and how of the drug use
Yeah.
that's the problem? Yeah,
And how they're forced to use it so that they're forced into that unsafeness.
yeah,
And I'm not even sure
yeah,
that's a word, but
yeah. Because
unsafeness.
I know some of the next few questions are about harm reduction. So I
Yeah.
think drug use itself isn't a public health issue. It's how, yeah, how people are forced to use drugs
Hmm.
that can be in an unsafe way that then becomes the more of the public health
Hmm.
concern.
Hmm.
Yeah.
And it's, I mean, it's so complex and so varied, various pathways into the drug use, and then, sort of various reactions depending on situations and, the resources and all those kinds of things that folks respond to that once the drug use becomes a challenge, right? So many
Yeah.
things are, I mean, there's lots of folks that sort of think, well, they choose to use drugs, so there's that's the end result. But so many pathways and so many reasons and so many obstacles that they just can't get over, um, even if they're interested in stopping the drug use. We don't support that at all either, adequately.
Yeah, so it's kind of, I was just thinking about unsafe spaces. So being forced when drug use is criminalized, people have to
Hmm.
go into spaces where they might, those spaces might overlap with public spaces and use unsafe practices to avoid, being marginalized or having, criminal justice issues that might
Hmm.
arise from there and how they're using drugs. So then that can impact the broader public depending on the spaces and what drugs are being used and how, and um, so create unsafe spaces. But then also, I think just the demand on the public health system. So I was thinking about alcohol use in particular, and when people have alcohol use disorders, and if you know um, when people are very marginalized in severe alcohol use disorders and they overconsume alcohol and it leads to even it leads to even more severe impacts of their alcohol use disorder by either the amount of alcohol that they're using or the types of alcohol when people are forced into sort of non-beverage alcohol consumption, so things like hand sanitizer
Hmm.
and other non-beverage alcohols, and then that puts more pressure on our healthcare system. So when people are using drugs in an unsafe way, or substances such as alcohol in an unsafe way, they can end up with more healthcare challenges that put more pressure on our healthcare system and then becomes a public health issue because those health resources are less available for other healthcare needs.
Right, right, for sure. Makes me think we've had in our community recently, we had a house that was relatively safe in the sense that there were people around and, there were naloxone kits and folks, that would be there with folks using substances. police decided to set up a observation, put a cruiser outside of the house to try and deter, that whole criminalization thing. And so folks just moved to the beach and an unsafe site, and we've recently had a death from really poor drugs, an overdose. They would normally have been in a safer place, out to the beach area, away from town, no naloxone, no support, and overdosed and died. It's that forced into a decision, right? Because of the system and the criminalization and that kind of thing.